Hi, I'm Dr. Vineeth, General Surgeon at Meitra Hospital, Calicut. Today, we'll discuss about one of the commonest conditions, that is hemorrhoids or piles, and the painless treatment or the latest painless treatment available for this condition. A majority of patients with hemorrhoids who present to you already have symptoms, the most common being bleeding, perianal discomfort, itching, and sometimes very painful swelling, or otherwise known as thrombosis. When coming to the treatment of hemorrhoids, most of the patients ask for painless treatment of hemorrhoids. We have plenty of techniques for treating hemorrhoids, that is the age-old open technique, then came the staplers, and recently we introduced lasers, and latest being a painless technique, or otherwise known as Doppler guided hemorrhoidal artery ligation. The main aim of treating any hemorrhoids being cutting off the blood supply to these pile masses so that it shrinks and then there is no episodes of bleeding. The advantages of this DG-HAL technique is that the postoperative period remains painless and patients can return to work early with a very short hospital stay. What we do in this technique is we use an instrument called as trilogy. This is the instrument, and we have a probe, or otherwise known as a Doppler probe, which we can insert into the anal canal and then identify the blood vessels using the sound waves of the arteries. So depending on the sound waves, we localize the hemorrhoidal arteries and we put ligages so that these arteries are kinked and there is very less blood supply to these pile masses. During the postoperative period, these patients have very minimal or no pain, and hence we discharge them during our first post-op day, and then they can return to their work in another 2 days of time. So those who are having these hemorrhoids or bleeding pile masses, you can consult your surgeon to avail this latest painless technique called as DG-HAL.